Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today.
I feel honored to be able to hear their message, but also provide necessary input and do so in a way that's not overwhelming, because I've learned so much over the years, but it's also like how that communication is established and making sure that it's received in a way where it can then empower and a parent is given actionable steps.
You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Palladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Hello and welcome to the Tongue Tie Experts podcast. I'm your host, Lisa Palladino, and today I have a very special guest, Dr. Chelsea Pinto. Dr. Pinto is an educator and dentist in Woodland Hills, Los Angeles, California, that has solely dedicated her practice to focus on infant, toddler, tongue, and lip ties. Dr. Pinto has successfully treated thousands of babies with oral restrictions and proudly provides families with knowledge to support their child's oral motor skills, including appropriate therapeutic and feeding support referrals for an individualized and comprehensive approach. As an advocate for honoring anatomical and physiological normalcies, she teaches proper diagnosis and treatment protocols in order to avoid unnecessary procedures and overtreatment, and to address the importance of establishing optimal oral motor function and tongue posture early on to support feeding, breathing, sleeping, and speaking habits as babies grow. Collaborative care that holds a focus on empowering parents is her passion. In January, Dr. Pinto launched her research-backed, mindfulness-based infant frenectomy protocol, her education course geared towards providers in the field of infant, toddler, oral, or functional care. Dr. Pinto and her husband have 2 little boys and a dog. So welcome, Dr. Pinto. It's a pleasure to have you here. And so many things in your bio just jump out at me. And I think you know that that's why I invited you to discuss your work today, because your ideas about empowering parents and the feminine approach that you speak about, that's all me, right? And I was just so excited to meet you, hear you present, and to have you today. So welcome.
Thank you, Lisa. And thank you for inviting me. And I'm excited to dive into it because I think all of those topics are so important to capture in kind of the essence of how we treat and how we love and how we care for each other.
Exactly. And, I think one of the highlights of your work that overlaps with my approach and my paradigm is that more feminine approach. There's a lot of guys in our field, right? And they're doing a lot of good things, but I think they're ignoring the maternal aspects a little bit and not focusing on them. Do you have any thoughts on that?
Yeah, and nothing against the guys, but I think there's obviously just something that comes with being a woman that we just, there are things that just click and that may just come naturally that might be harder for a male. And of course, we're all so unique and special individuals, but there is certainly something about even just diving into motherhood myself and looking back and how that shaped the way that I approached then meeting new parents. And not to say that you have to be a parent to be, this sort of get it provider, but to really capture all that goes into motherhood and the depths that come with this journey, from an emotional standpoint, from all these layers that come with changes to our mental clarity or lack thereof, and the physical being. And so there's something that can come from the female side of things, especially when experienced ourselves, and diving into really kind of like a new life, I would say. At least when I entered motherhood, I felt like so much of me had changed in an amazing way, but I also faced, feelings that many moms do that maybe aren't talked about quite a lot, whether it's overwhelm or exhaustion or anxiety. And I think finding my way and kind of working through my own personal journey through that has, again, led me to really apply that to how I treat and how I focus my practice.
Yeah, and it's evident in your work. I honor that idea of woman changing completely. I'm a midwife in my heart, by training. I'm not catching babies anymore, but I'm always a midwife. And the profound changes that we go through and the denial sometimes of our society about how we change and how it's not always easy to do it all. And maybe we can't do it all in the same way anymore, and that's very hard, especially for us professional women who have built up a career and want to be doing everything. And, I had a very wise mentor once tell me, Lisa, you may not be able to do everything you want right now. And this is when my babies were really young. She said, but someday you will. And I remember that day as clear as anything. And every time I have a success now and doing things I could never have imagined having time for, I'm like, she was right. She was right. And I wish she's since passed and I wish I could talk to her, but she's always in my heart thinking about, she was a career woman. She was a working single mom and she achieved great things, but she told me it's got to be in good time, so it's an adjustment, motherhood.
Yeah. And I love what you brought up, a few things there, but one being time. And I've gone through waves of trying to figure out time and went through a lot of years feeling like there was just never enough time. And we were surrounded in this society of ours where I think there is this concept of women doing it all, and it's a beautiful thing. It's like, it's well-meaning. We're like, women can do it all. We can balance it all. We can accomplish all these things. And not to say we can't, but it's like, for me, I'll speak for myself, and I think many women do the same. It's like we add this pressure on ourselves. And I think for many years, especially being excited in the beginning of my career, and seeing the pieces come together. And it's like, I for many years was very like, go, go, go. And there was no like, oh, I don't want to fill my schedule. It was like, I had to learn permission to give myself a break, because I think when we don't give ourselves breaks as women or people in general, life is going to schedule the break for you. Life is going to hit you in the face and say,
yeah. So, my mom actually, rest her soul, taught me early on. She used to say to me, I was a very, very, very dedicated student, but she would recognize in me when I was getting burnt out and say to me, Lisa, do you want to take a mental health day? And I had friends whose, they had to fake sickness to stay home. And my mother actually encouraged it when there was nothing really important going on. If she saw me getting run down, she'd say, why don't you stay home today and just rest and relax and do things you want to do so that you'll feel better for next week when you have, finals or whatever is going on. So that was instilled in me early on. But you kind of forget that when you're trying to keep up with the Joneses and look as great as anybody on social media and have your career moving as fast as you had planned, so yeah.
Sure. Yeah. It's easy to kind of get wrapped up in the hustle bustle, the day to day. And I don't know, it's like challenging ourselves to say, well, why do we actually have to wait until we're at low capacity or our batteries at zero to take the break? It's like, I think for me, like what's really helped with creating more of, well, I don't know if there's such thing as a work-life balance. I think there's more creating presence. And what's helped me tremendously is scheduling out time for me and scheduling out the time that I really protect for my kids and my family. And because for me, that's so crucial and so uplifting and so fulfilling, just as much as my work side of things. And when we schedule those periods of downtime, also removing any feelings of guilt with it too. I think for a lot of women, like we can be overcome with this like mom guilt or, oh, I should be doing this, but there's actually no rules in life, like,
right.
And when we realize that, like we get to craft and we get to create the schedule that feels best for us, truly. And at the end of the day, and kind of having some of these periods of softness and having these periods of quiet, maybe you can weigh into it. I look back at some times where I've just kind of unplugged and taken some time. And it's actually those periods where I think more clarity and more growth to then like come back with a fresh face and like a full force and more of what sparks us, right? Like sometimes that's exactly what we need, but we just get caught in this wheel.
Yeah, because we can push ourselves to the point of burnout, and then our energy and our ideas fade, and our drive to create new things can be thwarted because we're just kind of coasting. But like, let's switch the gears and reference this to the population that we work with. So knowing that a woman is coming to you with her newborn, in my case, they're coming to me for lactation support. In your case, it's probably a little bit different or maybe similar. And, they're afraid that there's something wrong. They're at a vulnerable time in their lives. They're, most often very new postpartum, going through all these changes. So, the fact that you address that as a dentist in your work and honor the woman is just heartwarming to me. So thank you for doing that. And
It's an
yeah,
honor.
yeah.
Yeah, and a lot of what we just mentioned, I think, applies to, again, meeting the woman and meeting a new mom on their journey, because it again comes with like this picture sometimes that society paints, and sometimes people don't have, helping hands in place, or people that are kind of on their team to even like relieve them of some of this heavy exhaustion, or even people on their team that are really giving them some mindful, empowering messaging, depending on where and how a woman gave birth, the whole history that kind of sparks from the very beginning. Sometimes women are given messaging that it's like they're already on this wheel of extra worry and fear and doubt, and it's all feeding your baby. That's what you're doing in the early months of life. It's overwhelming regardless of having feeding challenges, but when those things come into play, and every family coming in really is struggling in some capacity with their child's feeding skills, or, has concerns about oral posture or breathing habits. I feel honored to be able to hear their message, but also provide necessary input, and do so in a way that's not overwhelming, because I've learned so much over the years, but it's also like how that communication is established, and making sure that it's it's received in a way where it can then empower, and a parent is given actionable steps, and also just loved and hugged. Like there's just that's what life is about, is well, we all want to feel loved and hugged and seen,
Right.
and
Right.
and sometimes women coming in, they haven't gotten that yet, and I've had moms like break down in tears just because they felt like they could just talk and sit and sip on a cup of tea, and feel comfortable in a space and an environment, and not rushed, and we can just sit and talk it out, and
Yeah.
that's aside from the medical side of it.
Right. But that's the feminine touch that sets you apart. And, I do the same. I have a tissue box on the table next to the couch where mom sits, and they walk in all set for a regular like medical type appointment. And I'm like, no, hang out. Let's talk for a while. As long as the baby's not screaming and they're settled or whatever, let's just talk. And I'll often say, tell me your story. And they've never told their birth story. They've nobody has asked them how they feel about how they gave birth. Not even their family. Usually, families just are like so like excited about the baby, and nobody's saying, "So how do you feel?" And your feelings matter, and validating that. Because if we're going to heal this feeding relationship, we have to start with healing the mom, right?
Yes.
And recognizing that. And I know you're doing this beautifully. So what's the question I want to ask you is, did you evolve? Like, how did you evolve into this type of care? Because it's not typical for dentists. Like, it's typical for us in lactation care and midwifery, but not typical for dentists. So how has this transformation happened to you or to your practice?
Yeah, great question. I think slowly over time, after 2016 is when I treated my first baby with a tongue tie, not my own, but when I treated a patient. And the office setting that I was in at the time was a real cute family practice in Santa Monica, and I felt very blessed to have the support of the owner dentist. She helped assist with the baby, and I remember it very vividly. But as time went on, and kind of I interacted more with the community, and and this was before I had kids, but I very quickly recognized the need for the environment. So like you mentioned, a mom sitting, and we kind of talked about comfortably in the tissue box, and these little details, right? Those little details very quickly became clearly things that I wanted to integrate into the setting, because it was, again, like, I guess just inside of me, I knew what felt good. And there was something about not having a private room in the practice for a mom to breastfeed her baby. I mean, there was space and there was no rush to leave, and it worked, right? But I always had this goal in my mind of, like, this was the space that I knew I wanted to create and the space that parents deserved. And then again, I think it was diving into parenthood. I remember going to our first pediatrician appointment with my eldest son, and I literally felt like we were a check mark box on a list.
Isn't that terrible? It's so sad when that you get that feeling. And
Yes,
and hurry up and hurry up and hurry up
Yeah.
and wait, and then hurry up with, and try and remember what you want to ask. And
Yes.
it's so sad.
Yeah, and it felt cold and it wasn't comfortable. And I remember going back to the second appointment, and I'm like, in my mind thinking, couldn't she have just taken a couple notes on me and my baby? Because I went to the second appointment, and it felt like I was listening to a recording, right? Like a robotic, okay, and how's the breastfeeding? And and it's wild now looking back. So it's like, okay, well, 10 minutes this side, 10 minutes that side, and just, like all the things you learn as time goes by. And I'm like, it makes me cringe, right? Like that was the information I was given. Thankfully, I had lots of amazing colleagues even back then to help guide me. And so anyway, we switched pediatricians very quickly, but I bring that up because, again, it became very crucial to me to have this setting. And so it's like there's something that's created when someone walks into an environment and just feels a hug. They just feel the comfort. So that was one thing. Obviously, you kind of have to be where you're at, and there's steps along anyone's path, and same for me along my professional path. And I had, really great opportunities to then move along and then kind of create this space. And I took a big leap opening my own practice, about a year and a half ago, and officially, my own space. And it came with a sense of everything that comes with doing something new, self-doubt and questioning. And is this the way? But on the other side, I just felt so proud of what was created. And so, that was definitely an evolution, I guess, of the environment. And then I think for me personally, what has brought the most clarity to what I'm doing and how I'm able to connect with people is just kind of working on my own, individual spiritual development. I grew up in the Midwest. There was no talk of like self-growth or intuition, and or at least with my family. But I'm grateful that I married into a little bit more like spiritual focused, holistic focused family. And my husband's, just an incredible person that supports all my endeavors. And I think our team together, that's really what's helped me to accomplish the dreams that I've had here. But another kind of side of it, but marrying into, I think his family opened my eyes to this really crucial part of like the mental health, the mental growth. And so I went on a couple different retreats, basically, long story short. And I went on one actually when my first son was 9 months, and I felt myself waking up with, I was anxious. I feel like, some anxiousness came throughout dental school and studying and the pressure, right? Like we go back to the pressures we put on ourselves, but I left for 6 days. I left my, and I felt like, oh my God, I'm leaving and I came back a different person, and I came back with a whole new outlook and connection to myself. And that specifically is probably what changed my approach, where I felt so good, like shifting away from general dentistry. I feel like general dentistry was just kind of my path into kind of this non-conventional, unconventional kind of niche that I've taken to. And so that's what really did it for me, is focusing more on myself. And that has allowed me to apply that to my work and to create, again, like this presence when I'm with people. And I have seen such an evolution with my own care, because we're all on our own growth journey. And it's like each year, if you agree, it's like you learn more, it's like you have all these aha moments throughout your life. And that was kind of a catalyst, I think, to give myself time to have aha moments, and then be able to really love on moms and see how I can help them and see how I can guide them the best that I can.
So many things. Like I wanted to interrupt you so many times, but I wanted to let you finish. We have so much in common in that, my path was a little bit longer. I worked 28 years in the same hospital. Wow. And I knew the paradigm wasn't working for me anymore, and I knew I had to come out of it for reasons that would take hours and hours to explain. But when I started my own practice, I had all those feelings. Like you know what you want to create. You're scared to do it. It's overwhelming. Everybody's telling you. I was told that it would take me 3 years to make a profit. And I was like, what? That's crazy. No way. And I turned a profit the first month because I kept my overhead down. It's like a very easy shift into private practice. But I was able to say whatever I wanted to say in my own space, decorated how I wanted it to be, with the couch and, like I said, the tissue box and, water and tea. At the time before COVID, I used to serve like teas and stuff like that. And it just felt so good. But the same thing happened to me. The way I got there and the way I got the energy for it was a retreat also, where I was with empowering women, and it was like a reset your life kind of thing. And it was just wonderful, and just simple guidelines to live your life by, to be present, to start your morning with good intention. And I have this habit now of every morning, I take time for myself. I get up before anybody else and spend some time with myself, with my journal, with whatever spiritual practice I'm practicing at the time, and just getting to a space where I'm ready for whatever comes, instead of just jumping out of bed and being inundated with all the stuff before you've even woken up, So right. I see some similarities in our approaches, and I knew when I heard you speak at that conference that we would have a lot in common. You're just, it's wonderful to see someone so much younger, because I'm almost 60. And I'm at this, wise, empowered place. But you seem to be getting there sooner. And I'm excited to see you evolve even further as you go on. It's just amazing to watch your work and what you're doing.
I appreciate that. And I appreciate you sharing. And I think what excites me is kind of through, like, even my educational course, it's like all of this is highlighted, and as professionals, sometimes education, it's taken out of the equation, but it's such a big portion of it, I don't think it's as natural sometimes to intertwine the mind and the body and the spirit, but it's happening, and it's right. And we're talking about it right here, and kind of knowing how that can influence the care that we give. And I think also building our own confidence, right? Like with anything scary, whether it's diving into motherhood and everything that comes with, and just having the loving support and having like those people rooting you on though. But it comes down to ourself and building our own inner strength and confidence. And I think a lot of that confidence comes from doing the scary, protecting the time, kind of doing things outside of the box, because that's just where the growth comes. And it feels uncomfortable at the time, but always growth and development and evolution comes from doing the different. And
right. And here we both are. Because if you would have told me when I was 25 years old that someday I'd have a podcast about tongue tie, I would have been like, first of all, what's tongue tie? And I don't even talk in public. So what are you talking about? Like it's just so weird. It's so cool how we evolve.
Yeah, it is.
The other aspect of your messaging is collaboration. And that's key for me. And it's not always easy to find the right people to collaborate. And I just want to get a little bit more technical. In your own model of care, do you have other professionals inside your practice, or are you collaborating with other practices, for the lactation, for the speech, for the feeding, body work, and all the things that go along with that?
Yeah, not within my own practice, like not under my own roof. Although sometimes I'll have colleagues and guests and things come, but not on like a regular basis. So yeah, essentially all of the referrals to my practice are from colleagues and those that I've connected with over the years. So, that's pediatricians and lactation consultants and bodywork specialists and physical therapists and you name it, friends of friends and who there's a very wide network of people that are supporting the mom. And, when there's some concern, I think kind of the biggest thing is any provider knowing that I will give a very honest, open, communicative overview with my assessment and practice. And my practice has kind of evolved again within the last year and a half, where I provide therapeutic laser therapy on a therapeutic level. So photobiomodulation has really become a big component for me. So even when there's not a concern of maybe specifically a possible tongue tie, again, there's so many symptoms that can get wrapped up in having specific challenges that involve both mother and baby. So that's been a really exciting tool where I've really been blown away by the results and progress of the families, and I track everyone. And so that's been really rewarding too. So I think from kind of a collaborative standpoint, that's been an exciting way to support the child's other therapeutic modalities too.
That's very interesting to me. I'm not so familiar with that treatment, and I'm hoping that you're going to publish your tracking of those.
Yeah, I got
interventions.
I have some exciting goals. More like sometime in the next number of years. But yeah, I have some exciting things in the works, and it's been really cool to get at least this couple of years of experience and cases and things presented through the course too. So people can kind of see up front what and how, right? Like the applications and
yeah. Because we get couple things. We get a bad rap, those of us in the tongue tie field, for referring to certain people. And I think it's important to highlight that everyone who's doing this right is referring to the people who they know do a good job. They're not referring to people because they're going to get a kickback or quid, like getting something from it. It's because they know that they're referring to the people that have the same philosophy, will care for families in the same way, and they can communicate with efficiently.
And there's so many people out there and professionals, and I think also that kind of comes with time and building our own practice and philosophy, where there are definitely kind of that handful of individuals that I feel most comfortable referring families to, because I really understand their messaging and their flow of how they provide care. And that's really crucial. I think for a while, it's like, at least for me, like getting started in this space, I wanted to connect with as many people as possible. And there's nothing wrong with that. I mean, I wanted to meet, and I wanted to talk, and I wanted to learn. And it was all part of the growth journey. But I think as we build our own confidence and become more established in our own technique and connect those dots and things become very clear for us, then just naturally we form just kind of circles where it's like the best feeling when I can refer a family and they just have, they have nothing but praises to sing about the provider that they met with, or how the experience went. And it's a really great feeling, because I know for other people referring to me, it's a big deal referring to a provider.
Yes.
You're caring for that family. They become, they're part of you. That it's a reflection.
And you're responsible. You are responsible for your referrals as well.
Sure.
So
Sure.
there's that. So and the other thing that, because I know we're running out of time, I don't want to keep you too long. The trend towards avoiding unnecessary procedures is something that has evolved in my practice. In the very beginning, when I first learned about this, if there's a tongue tie, okay, send it to the dentist, take care of it, and then we'll worry about it. And now we're taking a step back. And I feel that you have that approach as well. You don't want to have to do a laser frenectomy on every baby that comes to your office, right? You want to be able to make sure that that is warranted and the baby's ready and the family's ready,
Oh, yes. And I think it would be a bit of a red flag if, every baby going into a dental practice was treated. But the reality is, that's how it is some places. And it might be a very well-meaning person, but without that person taking the time to understand what comes with new motherhood, what comes with the lactation journey, what comes with the breastfeeding journey, what little babies are like and their habits and their patterns and their physiology and their behavior, things can get lost and things can get very clouded based on, say like a list of symptoms on an intake form. Mm-hmm. And that can be one avenue that can lead to overdiagnosis or overtreatment when it's not warranted, when maybe that mother wasn't with an appropriate professional giving appropriate information. I mean, gosh, I could go on and on, because this is a huge,
we could do a whole episode on that.
This is a big driving force of why I created IFP. But also speaking from a provider's perspective, from the dentist perspective, I have found, and I have witnessed, and I still witness dentists who aren't taking ownership over their procedure. It's like if a dentist is going to make an incision in tissue and provide a procedure, they have got to have full 2,000% confidence that this procedure is for a reason. And that reason being to create more movement in the tissue, to create more length in the tissue. And if making an incision into tissue isn't going to do those things, a procedure shouldn't be done. So it's also like really, just taking ownership over the literature that exists, the intricacies of the tissue itself, and also not over manipulating tissues during an exam. So again, like there's so much to talk about here and that I could unpack, but that's what I created the course. So I can say everything I wanted to.
I know. And the same with myself, in my professional course, it's almost like a halting, like, wait, before you do that, before you send them, before you think about this, you want to make sure, first of all, that the frenum is what's causing the problem, right? Because we could see a frenum, but it might not be the source of the breastfeeding difficulty, right? And we want to make sure that everybody's ready for it, prepared for what it's going to be, both physically, emotionally, and all those things, and then guide the family to what it's going to be like afterwards before we send them, right? So there's different levels of practice, but I am very grateful that you are teaching your method, and I hope a lot of people take your course. I have it on my wish list for someday, and we have to keep doing what we're doing and teach other people to do things the way we feel is right, because our instinct about how things should proceed should be honored, I think, because our experience along with the education of the physical and the clinical things. Our experience is what makes us a better provider, and having intuition around that care is important.
Yes, 100%.
Yeah.
The intuition is going to create, and the clarity, the education, the proper background, that's what's going to create clarity and confidence for the provider, so that everyone feels confident, even explaining, all the details and the path.
Yeah.
When there's confidence and there's clarity, that's when there's empowerment, and really there can be more of a focus on the love and excitement of this small shift to a baby's body that can obviously, do extreme wonders and be so beneficial and needed for ideal outcomes and progress.
Yep.
So yeah,
we're helping families heal one family, one diet at a time, right?
Yeah, exactly.
Well, Dr. Pinto, thank you so much for your time today and your insight and sharing all of this with myself and my audience. And I will put your link in the show notes, but if you want to just say it for those who won't ever get to the written notes, what's your website? The best place to find you would be what?
Yeah, my personal work website and office website with some different resources on there is drchelseapinto.com. And then
great.
the course website, the educational platform, is infantfrenectomyprotocol.com.
Excellent. Thank you so much again, and we'll talk soon.
Thank you. Bye-bye.
Bye. Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue-tie Experts Insiders. It includes monthly online meetups with me, Lisa Palladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.